Well, good afternoon. Late morning, early afternoon. Wonderful to have you all with us. As you are aware, our Forum Speaker Series is presented each year by our wonderful partners at Hagen Hamilton Insurance Solutions. And we like to start off by dimming the lights and showcasing a profile video on that great company.
Do the right thing is our first value, and it's the most core to what we are as a business and what we do. We believe in long-term relationships. Doing things the right way is the only way we can do them. We've been in the community for 115 years, so everything we do starts with that value of do the right thing. We're going to make sure we do right by the client every single time.
Excellence is found in its pursuit. It's about getting a little bit better every day, overcoming challenges, setting high standards. Excellence is a habit. It's not a finish line.
I love working with my clients and strategizing with them to help them with their employee benefit plans. But coming back to the office and working as a team with my coworkers and those account managers is integral to what I do.
If you want to go fast, go by yourself. If you want to go far, go with the team. When you think about your business and your company and looking out into the future, you want to be partnered up with companies that are going to be there for you. Companies like Hagen Hamilton.
Hagen Hamilton is proud to sponsor the Forum Speaker Series, and we thank you for joining us. Enjoy the presentation.
At the Salem Chamber, we believe in helping businesses prosper so our entire community may thrive. More than ever, as our community faces immense challenges, organizations like the Chamber are very humbled to provide leadership in tough spaces. Today, our community conversation, as we look at the optics of health and an industry in crisis, we have an incredible speaker for you, and we're very excited to host our former governor, Dr. John Kitzhaber. Next month, we will additionally take on a very challenging topic facing our community. As our community learns more and more how our youth are doing in our public schools. And a little hint, it's not super well. We're going to take on that topic and health as we look at health in our community, because we don't just look at health in economic health terms or in medical health terms, but also education and many other facets. It's my honor to introduce your Salem Chamber President from State Farm Insurance, Mr. Ted Ferry.
Sounds like I have a fan club of one, so thank you, Tom. I wanted to first make mention how excited I am about today's forum, and of course he leaves as soon as I come up the stage just to hear Dr. Kitzhaber speak. Okay, don't go far. But I also want to take a moment to just welcome all new chamber members, as well as welcome to any first-time forum attendees. And speaking of which, some of you may wonder about this young lady sitting next to me. I wanted to invite you to get to know Castañeda Alvarez. She owns cleaning services here in Salem, and you can all get her business card later, right? I want to introduce her to you because she's a very faithful attender of the Salem Creators events, and she's one of our newest ambassadors. She and her company were awarded the 2025 Salem Chamber Business of the Year last spring. But more importantly to me, I attended a Chariot's business board meeting, and she took the time to educate herself, to make an appointment to come down and speak at that event. And she spoke not only in English, but also in Spanish very clearly. And she talked about the negative impact that tax could have on her business as well as other small businesses. So welcome, Susie, for being here. I'd also like to thank our Forum Season Series presenting sponsor, Hagen Hamilton Insurance Solutions. Also, thank you today's monthly sponsor, WVP Health Authority, who we'll hear from momentarily. And now would you please rise and stand with me to take a moment of reflection, which will be followed by the presentation of our national anthem, performed today by Elizabeth Roop Levitt from the Roadhouse Band. So let's pray. Gracious Father, we take this moment to pray or reflect, each in our own unique way, on our lives and on this moment. We are thankful for the meal that's before us, and we are thankful for those that make this event possible. We are thankful for our elected officials and the many leaders in this room, truly pillars. Help us all to have a heart of a servant. We are grateful for this day, for its blessings, its opportunities, and we're even thankful for the challenges and trials before us. Give us all wisdom, strength, and guidance to take on each and every day with the hearts and actions of love, joy, kindness to everyone we know. Amen. Elizabeth, will you please lead us?
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave.
Wow. Let me introduce you to Elizabeth Roop Levitt. I think we'd all agree she's a talented musician, and also you may not know she's a teacher. She's also the lead vocalist for Roundhouse Band. I think we all need to check them out. So please go to roundhouseband.com, check them out on social media, all the normal platforms. But thank you so much for sharing your talents. We really appreciate that. So that was amazing. I'd like to introduce the head of the table today. Sitting to my far left is Jason John, CEO and partner at Hagen Hamilton Insurance. Krista Lovas serves as the Senior Director, Provider, and Community Relations for WVP Health Authority. And then, of course, Dr. John Kitzhaber, the former Oregon governor, and our keynote speaker today. And he is the Health Policy Chair for the Foundation for Medical Excellence. And then, of course, Azucena. And then seated to my far right will be Tom Hoffert, who is our Chamber CEO. So please welcome me in joining the head of the table. And I got a list here somewhere. So I'd also like to wish a very hearty thank you for coming to our elected officials. We have Marion Commissioner Colin Willis, Salem Mayor Julie Hoy, Ward 3 Councilor Shane Matthews, Sarita Cross from Keizer City Council, and then we have Jackie Frankie and Ken Hector from Chemeketa Community College Board. So thank you all for being here. And now if we have any past presidents in the room, and I know I saw a couple of them, if you could please stand, past presidents of the Salem Chamber of Commerce. Thank you so much for being here. And then one special thank you to the current Salem Board of Directors. Could you please stand, and thank you for volunteering to lead this great organization. So thank you for being here. And now it's our special honor to award the Spirit of Salem Award, and Tom Hoffert will be presenting that.
Well, thank you, President Ferry. This is always a real treat. The story I'm about to share is one of gap identification and commitment to fill said gap. Beginning in 2005, this organization began as an outreach by West Salem Foursquare Church with the vision of providing free medical care to community members who are not covered by insurance. For the next 4 years, Walker Middle School offered the use of their gym to have free medical clinics on Saturdays. Based on a first-come, first-served basis, some individuals would line up late in the evening in order to save their place to be medically treated the next day. In 2009, expansion was afoot. Salem Free Clinic moved to the Northgate Center located on Portland Road, allowing expanded service from 2 clinics per month up to 10 clinics per month. With the support of Salem Alliance Church, they moved into their permanent facility where you see them now today inside Broadway Commons. This new home fit their patients' needs and set up a system for appointments instead of having patients wait in line. A dental facility was soon constructed. In 2011, they began a formal partnership with Corban University graduate counseling program to establish the Salem Free Counseling Clinic. Over time, they added more clinical staff, expanded their hours of service to those most vulnerable in our community. Today, Salem Free Clinics services include a full scope of medical, dental, and counseling services. This organization has continued to evolve in our community based on the needs of this community, and now have a presence in Monmouth, in Polk County. From a gap analysis to a community resource, the organization is run today by a skilled 13-member board of directors team and a committed staff team. Today, our organization is honored to recognize Salem Free Clinics as our October Spirit of Salem Award recipient. Join me in welcoming Salem Free Clinics CEO, Trina Fowler, to the stage.
Wow, I was just honored to meet former Governor Kitzhaber before it began, and I was sharing with him just 2 amazing stories that we just had in the last 2 weeks of a mom whose daycare provider called and said, your son is sick and you need to come pick him up. So she has to leave work, and she called 4 doctor's offices and nobody would take him. And she called Salem Free Clinics and we had an opening, and sure enough, he had an ear infection. We got him antibiotics, and then she can go back to work. And 3 years ago, Governor Kitzhaber said, what are the upstream solutions to keeping people off the streets? And I wanted to raise my hand and say, Salem Free Clinics is one of those upstream solutions. We have 35 providers, MDs, PAs, physician's assistants, nurse practitioners that volunteer their time. 6,500 patient appointments last year alone. We had a truck driver that was losing his job because of a high blood pressure and found out about us, and we were able to stabilize his blood pressure and he didn't lose his job. So many people think we're serving the homeless, but the homeless qualify for the Oregon Health Plan. We are serving construction, agriculture, restaurant workers, retail workers, and so many others that are falling through the healthcare gaps. And I'm just blown away. I'm so honored, and Diane, you got me. I'm very, very humbled to be here, and it's such an honor to be a part of 200 volunteers giving of their time to serve people in our community that need it. So thank you so much.
Well, now we're going to get into the main event, and I want to thank a great partner organization with the Salem Chamber. That's PAC West Lobby, and led by Ryan Tribbett, for helping us align some stars, organizations that believe deeply in a stronger health system for us here in our region. I now get to introduce my peer, Krista Lovis. WVP Health Authority began as Capital Healthcare Physicians in 1976. The organization first acted as the provider panel for the Capital Healthcare HMO. To establish greater independence, in September of 1991, the association changed its name to MVIPA by reiterating its articles of incorporation. At the same time, the IPA hired a staff member and began contracting with additional carriers. To ensure a common brand among healthcare providers, clinics, health plans, and other entities, the organization underwent an identity and rebranding process. The association changed its name to WVP Health Authority and opened new headquarters in 2010. Today, the association has grown to approximately 530 members, practicing primary and specialty care, serving Salem, Santiam, Silverton, and West Valley hospitals. The WVP Health Authority contracts with more than 10 insurance carriers and includes commercial, Medicare, and Oregon Health Plan. I am pleased today to welcome Krista Lovis to the podium to tell you more about their organization, as well as to introduce you to our keynote speaker today. Krista, the stage is yours.
Well, little nervous. I'll try not to embarrass myself in front of everyone here. Thank you for a lovely introduction and really a warm welcome to the Salem Chamber. WVP Health Authority, in addition to the work that we do to sustain independent practice, also has a strong root in community support. We have a peer support division that has over 20 peer support specialists that deliver boots on the ground community support to those patients that need it most, often taking them to visit the Salem Free Clinics to get the services that they need and the care that really is needed for our community members. We're all aware of the uncertainty that really is facing healthcare and the challenges, but we're fortunate to have experienced leaders to help us navigate to the future. It's an honor to introduce one such leader whose vision guided the evolution of Oregon's healthcare landscape. Dr. Kitzhaber's name stands for innovation, courage, and commitment to ensuring that all Oregonians, regardless of income, background, or circumstance, can access quality coordinated care. As both a physician and a policymaker, he redefined Oregon's focus from simply delivering health care to truly advancing health and well-being for our communities. He understands what happens in an exam room and built policy empowering physicians to practice medicine the way it should be practiced, grounded in compassion, prevention, and relationships. That unique combination of medical insight and policy leadership helped Oregon craft one of the most effective and compassionate Medicaid systems in the nation. Some of us here today, myself included, remember when Dr. Kitzhaber came to our Independent Provider Association, Willamette Valley Providers, and asked us to take the lead in managing the Medicaid care for our local patients. He placed that trust in independent physicians to serve our most vulnerable residents through community-based, person-centered care. That partnership, built on shared values and accountability, continues to define how we serve patients today. Because of his leadership, independent physicians across Oregon, including the members of our organization, are able to continue practicing medicine in the communities they love, caring for the most at-risk residents with the autonomy, flexibility, and integrity that define high-quality care, ensuring patients have choice in the way they receive their health care. For nearly 50 years, our members have been able to serve the Willamette Valley community, adapting to Oregon's changing health system while staying true to one mission, delivering exceptional patient-centered care. Today, WVP unites over 500 independent providers across 93 practices, including primary care, specialty care, and behavioral health. Together, we carry forward the principles that Governor Kitzhaber helped to establish: accountability, equity, and local collaboration. His legacy is woven into the fabric of our work every day. On behalf of the entire WVP network, the physicians, advanced practice providers, behavioral health clinicians, and administrative teams, we offer our sincere gratitude. His vision strengthened Oregon's health system and safeguarded the future of independent practice, allowing our members to continue delivering accessible, relationship-based care to those who need it most. Thank you for your enduring commitment to Oregon's residents and providers. Your leadership shows that the healthcare policy is guided by the heart of a physician, communities thrive. Please join me in welcoming Dr. John Kitzhaber.
Well, thank you very much for that kind introduction. I want to thank you again for inviting me back. I think the last time I was here was in October 2017, almost exactly 8 years ago. And there's a little bit of historic symmetry involved. In 2017, as now, Congress was engaged in a very contentious and deeply partisan debate over the future of the U.S. healthcare system. And in both cases, the debate did not address the real underlying problem, which is the escalating cost of medical care for individuals throughout our nation. In 2017, if you recall, Republicans were trying to repeal the Affordable Care Act, or ACA, which was the signature healthcare legislation of the Obama administration. And if you recall, the ACA expanded access to healthcare for about 45 million Americans, including 550,000 Oregonians. Did that in two ways. One was to increase eligibility for Medicaid to 138% of the federal poverty level, which made that program accessible to most working Americans. And secondly, it created a market for those who weren't eligible for Medicaid but didn't get health care offered through the workplace. And so these people could buy a policy in that market, and the cost of that was subsidized with federal dollars to make it more affordable. During the pandemic, those subsidies were increased, and I mention that because, and I'll come back to that in a minute, the central point of contention in the government shutdown is those enhanced subsidies. The chief argument of those who supported repealing the Affordable Care Act was that it was going to increase the cost of Medicaid to the federal government, and that part was certainly true. But the argument ignored the fact that the cost of health care had been escalating long before the passage of the Affordable Care Act. For example, between 2000 and 2008, the cost of a family premium to get access to workplace-based coverage increased over 97%. The ACA didn't cause the problem, but it also didn't solve the problem. The goal of the ACA was to make health care more affordable to more Americans, not by reducing the total cost of care, but by having the federal government pick up a larger part of the bill. And yes, that did in fact increase costs to the federal government. Now, 8 years later, the tables have been turned, and now we have the Democrats fighting the implementation of House Resolution 1, H.R. 1, the so-called Big Beautiful Bill, which is the signature health care bill of the Trump administration. Under that legislation, Oregon is going to lose about $11.5 billion in federal Medicaid funding over the next decade, triggering a multi-biennial budget crisis in our state that will be unprecedented since the recession of 2011, when we had about a $3.5 billion revenue shortfall. But like the ACA before it, House Resolution 1 fails to address the real underlying problem, which is an overly complex, inefficient system that has made healthcare essentially unaffordable for individuals, for government, and for employers. The legislation will reduce the cost of healthcare to the federal government in the short term, but as I'll discuss in a moment, it's simply going to shift those costs to employers through increases in their premiums in the commercial market. My point is, I guess, that healthcare, which is a business sector that drives 20% of the GDP and is the single largest employer in America, has become essentially a partisan football. For the last 2 decades, both parties have used this issue to gain a partisan electoral advantage while failing to address the root causes that are driving medical inflation in the first place. And the government shutdown, I just want to bring us back to that, now again in its 3rd week, is over that provision in H.R. 1 that would repeal those enhanced premium subsidies in the ACA individual market. If those aren't extended, about 5 million Americans will lose access to coverage. But the point is, regardless of whether these provisions are repealed or retained, it will have absolutely no impact on those fundamental drivers that are making medical inflation a huge problem that it is here in America today. In short, Congress is involved in a heated debate over the wrong problem, dancing on the head of a pin, if you will. The spin artists on both sides are crafting narratives not to curb the inflation in medical care, but rather to figure out how they can blame each other for the government shutdown. What about the blame of failing to address a healthcare business model that has given this country the dubious distinction of having the most expensive healthcare system on the planet, producing some of the worst world population health outcomes? And I think the blame for that rests with both parties, but I think it also rests with most of us here. One of the reasons, in my estimation, that neither party has taken on or showed the courage to take on the total cost of care is that for decades, payers and providers and consumers and labor and business have refused to come together around the kind of systematic change that is the only path to a sustainable solution. And as long as we remain in our silos, as long as we don't recognize that all of us are going to be negatively impacted if our healthcare system falls apart, we're going to continue to perpetuate this zero-sum politics of scarcity that's great at producing winners and losers, but can never produce a lasting solution. And I think we can do better. And so what I'd like to do today, the next 10 or 15 minutes, is to first leave you with a better understanding of how our healthcare system is financed, why it's in crisis, and why simply pumping more money through the current delivery model is not going to work. Second, I want to emphasize that any long-term solution to the healthcare system here in Oregon is going to require the engagement, the constructive engagement of the business community, both small businesses and large businesses alike. And finally, I want to remind you, and maybe this is the most important message, that we're not powerless here. I don't think we can expect a solution in the next few months to come popping out of Washington, D.C., but we don't have to let the healthcare system here in Oregon get swept over the fiscal precipice that's rapidly approaching us. So let's start with the central problem. The central problem with our healthcare system in Oregon and around the country is that it's based on what I call a fiscal fantasy. In other words, the escalating cost of care is disconnected from the resources that are available to pay for it. So consider this. Healthcare is probably the only business sector that produces goods and services that none of its customers can afford. I mean, think about it for a minute. The only way this works from an economic standpoint is that the cost of healthcare for individuals is heavily subsidized, increasingly with public resources. The subsidies are provided either directly through programs like Medicare and Medicaid, or indirectly through the premium subsidies that I mentioned in the ACA individual market, or through what's called the tax exclusion, which exempts the cost of premiums that employers pay to provide health care from their workers from federal income and payroll tax. That amounts to about a $270 billion annual subsidy of employer-based coverage. So as a result, almost everyone in America relies on some form of public subsidy to help afford the cost of their health care. So if you're on Medicaid, the subsidies come from the federal government and the state government. If you're in the ACA individual market, it comes from the federal government. If you have workplace-based coverage, it comes from your employer and the federal government. And if you're on Medicare, of course, the cost is provided by the federal government. The point is that the business of practicing medicine or running a hospital only works as long as government and private sector employers are able and willing to continue to pay these subsidies. But what's happened is the cost of health care has relentlessly increased. Both public and private payers have sought ways to shield themselves from the cost shift, from the cost of care, not by reducing the cost of care, but by shifting the cost to someone else. This is probably the one slide I want you to remember when you go home today. States have to operate on a balanced budget. So they're increasingly put in the position of financing the increasing cost of health care by cutting investments in education, in housing, in economic development, and public safety. So at some point, they simply change the eligibility criteria for Medicaid and drop people from coverage altogether. The HR1 is going to force us to do that. Probably 200,000 Oregonians will lose coverage under that bill in the next few years if all things stay the same. If you have the federal government is not required to balance the budget. So what they've been doing is increasingly pushing the cost of Medicare and Medicaid and the tax exclusion into the national debt and leaving our kids and grandkids to pay the bill. And I leave it to you to decide whether that is a morally defensible or economically wise policy. Employers shift the cost to their employees by increasing co-payments and deductibles, often to the point that for all practical purposes they aren't insured. And smaller employers, under 50, which is most of Oregon's businesses, that don't have to require or don't have to provide coverage under the ACA, either don't or drop coverage altogether. So one of the most important things to remember is that people who don't have health care don't just disappear. They still get care. When they get sick enough, they go to the emergency room, which is one of the most expensive care settings, and then a federal law called EMTALA, the Emergency Medical Treatment and Labor Act, requires that they be seen and treated. And those uncompensated costs that are generated in the ED are simply shifted back to the business community through increases in commercial rates. So cost shifting is the direct response to the total cost of care. And paradoxically, it drives this vicious cycle that continues to increase the number of underinsured and uninsured people in the system who can't afford the cost of the care that they're getting, eroding the fiscal stability of the entire system. And that's what's happening today. It's like the dikes in New Orleans. They're not working, and we're not going to know about it until a flood hits. And what I'm imploring you today is that we are not powerless to do something before that crisis happens. Cost shifting is also the direct result of the fact that we don't have a uniform fee schedule across all payers. By that, I mean that unlike most functional markets, healthcare consumers are often charged vastly different things for exactly the same thing. Suppose you wanted to go buy a car here in Salem. My next favorite slide right here. So you could go to a number of different dealers, and those dealers would tell you that the base price of the car may differ from between dealership to dealership, but not by very much, just a few percentage points. And I did check this out with my favorite used car salesman, Dick Withnell, so you know it's true. But suppose you need a colonoscopy. You're going to get charged between $1,500 and $10,000 for that procedure based on where you get it or whether it's being done for diagnostic and screening purposes. That's a variation of over 150% for exactly the same procedure. Here's another example. Suppose we have three people, one's covered with a good commercial policy, one's on Medicare, or one's on Medicaid. They're walking down the street together, they all step off the same curb, they all break their left ankle in exactly the same place, they all get exactly the same treatment from the exact same orthopedic surgeon. That surgeon is going to be paid much, much more to treat the person who is on commercial insurance than the person on Medicare, and far less to treat the individual on Medicaid. In what universe does that make any sense? A system that pays less to care for the poor and the elderly for exactly the same thing is not only morally and operationally bankrupt, it's fiscally unsustainable as well. Why? Because the lower rates for Medicare and Medicaid are simply shifted to the commercial market through increased rates. And that's why if you're an employer, you're seeing double-digit year-over-year cost increases in your premium. And more importantly, because in a very real sense, there isn't any more money to fund this system. And if you doubt that, ask yourself the question, where is that money going to come from? Where do we actually think it's going to come from? Well, it's not going to come from individuals because most of them already can't afford the cost of health care. And that's what private insurance is for. But having an insurance policy is no guarantee that you can pay a medical bill. The leading cause of bankruptcy in Oregon and in this country is the inability to pay a medical bill. And the vast majority of people who go bankrupt over medical debt have good health insurance. It's not going to come from the states. We don't have it. And as I said, we're bracing for an $11.5 billion shortfall in Medicaid funds over the next decade. And anyone who expects an increase in federal reimbursement, I think, is operating in a different reality. The Trump administration is clearly moving in the opposite direction. But I think more importantly, the cost of health care right now from the federal government is being borrowed increasingly from future generations. Our national debt is $37 trillion, up from 18.8 10 years ago. That's a 92% increase in debt. Our debt to GDP ratio is approaching what Greece looked like a number of years ago. It's not a healthy sign. That leaves commercial payers. And I don't think commercial payers are going to continue to do this either, at least not long. As we've talked about, lower reimbursement of Medicare and Medicaid is shifted to private sector employers through increased premium rates. And then they shift it back to their employees who can't afford it, driving this vicious cycle. And I don't believe that employers can or will passively accept double-digit increases in their insurance premiums going off into the future. The only way to avoid driving this system into insolvency is to fundamentally rethink the business model on which it's built and the financial incentives that drive it, the financing structure, the eligibility structure, and the benefit structure. And that starts with a shared vision for what we want our healthcare system to look like in the future, let's say 7 years from now. The values we want it to reflect, the outcomes that we want it to produce. Now that may sound daunting, but there's precedent for that. How many of you here are old enough to have remembered the speech that President Kennedy gave in 1962 when he challenged us to go to the moon? Anybody besides myself? A few. Well, I suspected that might be the case. I want to read you just a paragraph from this speech. We shall send to the moon, 240,000 miles away, a giant rocket made of new metal alloys, some of which have not yet been invented, capable of standing heat and stresses several times more than have ever been experienced, on an untried mission to an unknown celestial body, and then return it safely to Earth, re-entering the atmosphere at speeds of over 25,000 miles an hour, causing heat about half that of the temperature of the sun, and do all this and do it right, and do it before the end of the decade. What an amazing leap of imagination that was. Kennedy didn't give us a roadmap. He gave us a destination. And in so doing, he changed the nature of the debate from where we want to go to how we get there. And he inspired the innovation and passion of our nation in common cause. And we did it. We got there in 7 years. We did it because we imagined it. We did it because the story preceded the accomplishment. That's why a shared vision for a healthcare system is so incredibly important. A destination for all of us to reach, a way to change the debate from where we want to go to how we're going to get there together. We can do this because we've done it before, and I want to give you 2 examples. In 1990, Oregon had one of the most expensive workers' comp systems in the nation. It was characterized by high injury rates, excessive litigation, and really lousy benefits for injured workers. And everyone said, there's no way you can fix it. It's too complicated. There are too many stakeholders involved. And guess what? We brought everyone together and we asked a simple question. What would a more rational, affordable workers' comp system look like? In other words, we agreed on a shared vision for workers' compensation. I was Senate President at the time, and my job was to put together the legislation and the politics to make it happen. And we did it. We did it in a 1-day special session on May 7th, 1990. And the result, worker injuries dropped 50%, worker benefits rose to the national median, sometimes above the national median, and employers saved $17 billion. We did it again in 2011 during the Great Recession when Oregon faced a $3.5 billion revenue shortfall, a totally divided and polarized electorate because of the ballot measure 66 and 67, and a House of Representatives that was split evenly between Republicans and Democrats, 30-30. We managed through that budget shortfall without tearing the state apart, without losing our sense of community or our commitment to one another. And out of that budget crisis came Oregon's coordinated care organizations that not only expanded coverage to 380,000 more Oregonians, but reduced the cost of care in the process. I think we're called upon, once again, to rise above the divisive polarization and partisanship that has come to be the hallmark, I guess, of our national political dialogue, and certainly to some extent here important. And I think we're called again, once again, to come together as a people who share a common future and who will all be impacted if we don't change the trajectory that our healthcare system is on in 2025. The central question today, it seems to me, is whether or not we are going to remain in the false security of our individual silos, blaming other people for the predicament that we find ourselves in, and while feeding a vicious cycle that's accelerating our collective drift towards the lip of a precipice. The fact is that we're all in the same canoe here. We all need health care. And we can paddle together towards a safe shore, which we have done before, or we can hold on to our individual stakeholder paddles and work as hard as we can to keep our end of the canoe upstream, deriving some sense of security from knowing that the people in the other end are going to go over the falls before we do. Sometimes I feel like we've been captured in this false narrative of extremes. Red states, blue states, left and right, Republicans and Democrats, blame and division. It's a narrative that has no center, no common purpose, and no shared destination. And quite frankly, I don't think most of us like it very much. It's just not a very comfortable place to be. So let's remember that partisanship is a choice, and so is civility. We can choose to buy into the fear and the anger and the mean rhetoric and feed the negative energy that it possesses, or we can make a choice to move beyond it. We can make a choice to move beyond it. Unlike 1962, what we face today is not a challenge of technology. It's a challenge of political will. It's a measure of the depth of our commitment to one another and to our state. And it's a choice to see each other as fellow human beings who face a common challenge, one that cannot be solved unless we meet it together. 7 years, it's a lot easier than going to the moon. Thank you.
Dr. Kitzhaber will take some questions from the audience, if that's all right, sir.
Yes, sir.
And a number will come right through. Commissioner Willis will be to you next, sir.
Well, Governor, I'm about ready to change my mind of you.
Whoa. Let's explore that question a little deeper.
You addressed two of the issues that I see in what's wrong with our healthcare, and that's government and politics. One you did not address is greed. Greed based from pharma and insurance companies. How are we going to address those two issues at the same time while we're trying to get government out of healthcare?
So I want to just maybe poke at one part of your question. Good question. I will definitely answer it. You know, government provides $2 trillion a year to support the healthcare system. So I think we need to define what we mean by getting government out of it. I would argue, with the CCOs as an example, that when we set that up, the idea was to give a pot of money, a set of outcome measures to the CCOs and have them manage it, not try to micromanage it. I think the regulations that have been added on top of that are enormously costly and expensive. I think that's true of the larger healthcare system as well. I don't think we can probably not spend a single public dollar on healthcare because of the overall cost of care. No one can afford it. So I think you do need a role for government, and it is to provide some level of subsidy. The question is that subsidy equitable? And I do think one of the greatest inequities of our subsidy right now is the payment structure, where you pay a lot less for some people than other people, and then that cost is sort of implicitly shifted. So reducing regulations, making the system much more complex, more user-friendly, and easier to practice in and easier to navigate is definitely important. And government does play a role, I think, in those kinds of complexities. Secondly, and I'm sure this is a controversial issue, the question is, you know, is the whole question of greed. unregulated pharmaceuticals, essentially, amount to a kind of rent-seeking, if you will. The people at the bottom basically have to pay that price, and those prices, that profits go up essentially to feed a shareholder at the corporate level. I personally think that there needs to be some regulation of the pharmaceutical industry. Other than New Zealand, the U.S. is the only place you can have direct-to-consumer advertising of pharmaceuticals. I think that definitely we need to recognize that healthcare is not just another economic commodity. It's something that people actually need. It's a matter of life and death. So I think we have to have a conversation as we redesign the system about A, the role of government, B, the role of simply for-profit making in the context of a service that I think most people need. And I think, you know, if we just can start out with where we want to end up, we want a system, let's say, that's much more efficient, that doesn't reward that kind of greed, one that has government involvement in certain well-defined ways. Then the question is, how do we get there? And I think that's where we are more powerful than we think. And it's when we did workers' comp, what we did is we didn't pretend that the economics and politics of going from where we were in 1990 to where we ended up, we made them explicit. And we said, okay, yeah, there's an economic problem here. There are winners and losers here. How do we mitigate that so we can get there together? And I think that's the process that we've done before in this state, and we need to do it again right now.
Thank you, Governor, for being here. I was reading an article the other day about the increased premium subsidies and the effect that those have on various states, and it suggested that it's not a big impact on the state of Oregon. Do you have any insight as to why those don't affect folks in Oregon as much as other states?
So I think it's about 150, 160,000 people would be impacted in the state of Oregon. So if you look at the Oregon's insurance market, the small group market, which is where most small employers buy their coverage, if they offer coverage, is also a fairly small market. The ACA market is very, very small. It's the individual market. It's basically people who can't afford, who aren't eligible for Medicaid but can't afford a policy with their place of employer. So I think it's small because we got about 4 insurance companies that have 99% of that market. It's Providence Health Plan, it's Pacific Source, it's MODA, and it's Regents. No, excuse me, it's Keizer. So it's very, very small. And I think it's probably because there's just not a lot of money in that market. It's not like covering a really large self-insured organization or, let's say, a big company like Roseburg Lumber. So it's very small. And the other thing is, and I think this is really important to recognize, I think the ACA individual market is the unfinished business of that piece of legislation because it's straight commercial. That is, there's no uniform fee schedule. If you go to look at every other government program or program that's heavily subsidized with public dollars, there's a fee schedule. Medicare has a fee schedule, Medicaid has a fee schedule, the VA has a fee schedule, Champus, the military coverage, has a fee schedule, not the AC individual market. So you can go from 138% of the individual, 138% of the federal poverty level, you're eligible for Medicaid, 139%, you're going to be paying the same rate that someone at 400 or 500% of the federal poverty level is involved. Well, I think you address that with the uniform fee schedule that I was talking about a little bit earlier.
Thank you, Dr. Kitzhaber. Ed Davis. And years ago, we were involved in a consulting group that actually provided stop-loss insurance to MVIPA and several of the Oregon Medicaid contractors. And through that, we had the opportunity to start receiving actually direct claims data from the payers with diagnosis codes and procedure codes and all those kind of things. And in the course of that, we one 2-year period, we did an audit of Medicaid claims for the state of New Hampshire for 2-year periods. And what we found was that the DHS in New Hampshire was very reluctant to go back to the providers and make them give money back where they collected the money for an old age disease for a 12-year-old, for example. And the reasoning was, if we make these doctors, especially in northern New Hampshire, receive the amount that they're supposed to get from Medicaid, they'll quit taking Medicaid patients and we won't have any coverage. And in the process, the federal government years ago, in an effort to control the cost of Medicare and insurance, put in the requirement that the insurance companies had to have no more than 15% margin for administrative costs. So what happened was we subsidized things with companies like United Healthcare that now have a whole string of subsidiary companies, including providers. So they're shifting the costs. And I would ask you to read a book by Chris Deacon, is her name, C-H-R-I-S, called The Great American Healthcare Heist. And I ran into that on the internet, and it's scary when you look at where the money is really going. And I agree with everything else you've said in terms of the fact that it's insurance and healthcare are separate but connected problems.
Yeah, you know, what we tried to do with the CCO, the original CCO model that we operated for the first 5 years, gave the CCOs essentially a global budget, and as you know right now, the way we pay providers is based on, it's sort of a retroactive payment system. You look at the claims you paid last year, and your rates are based on a projection of that forward. What we said is basically we should let CCOs make investments in the community that doesn't have a billing code, but have a big impact on health. You know, my famous example is the air conditioner for someone who has congestive heart failure, right? The system will pay, if the temperature in their apartment goes up to 95 degrees, it may tip them over into full-blown CHF. We'll pay for the ambulance and the hospitalization, but we won't pay for a $200 air conditioner to keep them out of the acute care system in the first place. So that global budget gave them the flexibility to directly affect the health needs of the community and not lose reimbursement for that. But also the global budget drove down utilization, and they could save money by basically squeezing low-value care out of the system. And I do think there's a deal here between payers and providers, where, you know, in many cases right now the risk is held at the payer level, and they manage utilization and cost by prior authorizations and denials, which is a hugely costly and complex and frustrating process. I think the providers actually should assume risk for those things they can actually control, and the payer should assume risk for those things that the providers can't control, like a catastrophic illness, for example. So there's a path forward here, but we can't get there if we stay in our little silos and argue about just our piece of the larger pie, because that pie itself is failing, and we're all going to fail with it if we don't do something fairly quickly.
Thank you, Governor, former Governor Kitzhaber. It's such an honor to have you here, Allison Kelly. In 1990, when you were the Senate President, I was a medical case manager at an injured worker program run at Salem Hospital Rehab. And back in those days, the average time off work for an injured worker was about 3 months. Because of that policy visioning and legislation, we were able to then introduce a program that shortened that time off of work from 3 months to about 4 days.
Wow.
So the question that I have for you is, how do we help people to want to get out of the silos and communicate? And I'll follow that question with just a very short story. In my role, I got to interview the worker. Tell me about your job. Do you like your job? 100 workers told me over 5 years, nobody's ever asked me that question before. Then I got to talk to the employer. We could get that person back on light duty, but we don't have light duty. Really? Tell me about your work, right? The employee would say, I'd like to go back, but I can't go because my employer doesn't have light duty. So in that shuttling go-between, we closed this ginormous gap.
Yeah.
And that's how we reduced 3 months to 4 days, saving millions of dollars for the employers we were working with, and helping these workers get back to like, wow, I love being back at work. But it took the willingness of everybody to sit and communicate. So that's the question.
Yeah, that's a good question, and I love the way. There's one of my favorite quotes is a book by Thomas Pynchon. I wouldn't recommend it. It's so dense that you can hardly cut through it. But the quote is, if you can get them asking the wrong questions, you don't have to worry about the answers. And I do think that my experience with the Oregon Health Plan, with workers' comp, with our coordinated care organizations, with the Oregon Plan for Salmon Watersheds, is that if you can create a space where people will come, it's much easier to do this as a governor because people will show up, and build a sense of trust and relationship. So it's very hard to demonize someone you just had dinner with. And I remember, I'll give you the best example. The Oregon Health Plan, that should never have happened. I mean, everyone, it was, I don't know if you remember, it was prioritizing all these services. We were in a national football, or a fishbowl. But I could feel the moment. We had, I think, 8 people. We agreed on 8 principles of what we wanted the system to do. We all agreed on that. And then the process was, if someone put something on the table that you couldn't agree to, if you wanted to stay at the table, you couldn't just say no. You had to say, well, that doesn't work, but here's 2 other things we can do that'll help us get there. And you could almost feel the moment when people around the table began to say, oh my God, we could actually be pulling off something pretty big here. It's a sense of community, but it starts by creating a safe forum where these people who have basically been competing with each other forever sit down and say, yeah, we need to work on this. And I've never felt as much, terror is not the right word, but I've been feeling the world slipping in the provider community, at the hospital level, at the clinic level, at the payer level. So there's a moment in time here, if we can capture it, I think that we can do something really remarkable. And both the Oregon Health Plan and the CCOs were based on big federal waivers. That is, we didn't let our thinking be constrained by whether it was legal or not. But we went back and got waivers. We had a rational program that was broadly supported by Republicans and Democrats, and we went back and got those waivers. And I think we have an opportunity to do that again.
Dr. Kitzhaber, I don't see another question, so I'll have our final question come from our organization itself. You brought us some ideologies and solutions of bringing people to the table. There are many community advocates in this room. What is the next step we may take as a community to put into action the very plan that you've asked for? Because I think you have a number of people here that will raise their hand and be willing to step up and do just that.
Well, we've got a little work group that we started back in February. I think Maggie Hassan from San Am was involved with that, and a number of other folks. Actually, Brother Dick with Nell was involved in that. I'm doing it right currently under the auspices of the Foundation for Medical Excellence, which is viewed as sort of a neutral forum. We're hoping we can get some cachet with our elected officials and have this group formally make some recommendations to the legislature and to the executive branch on a path forward. So we're going to continue to work on that. And I believe that we have a short session coming up in February. I don't think we are ready to do something major then, but I do think you could put a couple of proposals on the table that essentially begin to focus folks on the steps we're going to have to take to manage through the next 6 years. I mean, a loss of that magnitude is pretty significant. It doesn't hit really, the big hit is in 27, so we've got a little bit of runway. And I'm confident, this state is amazing, and there are people all over the state that want to help, that want to be part of the solution, and we just need to create a vessel and a pathway to get them in harness so we're all moving in the same direction. And I remain very optimistic that we can do that. And again, I think the business community is going to be absolutely central, because ultimately you guys are paying the tab. Hey, thanks very much for inviting me back.
It's funny, for this, knowing that you were going to be speaking, I shared this a little bit with you. I went down to the store and bought myself a blue blazer, got my jeans out, and I had my cowboy boots ready to go. And then I remembered, my wife doesn't let me wear white shirts. So I said, what should I wear? And she goes, wear your uniform like you do every other day. So here I am. This is my uniform that I get to wear. So I get to wear black because I have a problem with spilling stuff. So, good for you. You did great. You did great. So thank you so much, Dr. Kitzhaber, for participating today. Really appreciate your insights into that. I'd also have a few thank yous here. And a few mentions for the future. I'd also like to say that not all insurance people are bad, so remember that. But we'd like to thank Elizabeth Roop Levitt with Roundhouse Band for presenting our national anthem today. Really appreciate that. Thank you to Allied Video Productions, Capital Community Media, the Salem Convention Center, really just showcasing your talents here every time that we do an event here. So thank you for that. Thank you so much for our Salem Chamber ambassadors. You're not wearing your blue blazer today, but that's okay. Thank you for always providing the hospitality and the care for our people here. Thank you for WVP Health Authority for being our monthly sponsor. And then also thank you, Jason John with Hagen Hamilton Insurance Solutions for being our presenting sponsor for the whole series. Where are we at here? I got a long list. And we are down to next month, November 10th, in this room. We are going to be hearing from Salem-Keizer School District Superintendent Andrea Castañeda. She's going to be addressing the district's academic performance results, similar to what Tom was talking about, that were released October 2nd. It's very important for us to be here because we're going to hear about third grade reading and math proficiencies are continuing to be really alarmingly low, despite a modest increase in reading proficiency results. It's important for us as business community that we come to hear this information, educate ourselves so we can be a part of the solution, because these are the employees and the employers of the future. So I encourage you all to be here. And then the other one is on behalf of the board of directors and any other business that's being represented here, small or large or medium, I really encourage you, much like Castañeda did, spend some time learning about the Chariot's board of directors and the tax that's proposed. It's $40 million per year. It's a very significant tax, and we need to educate ourselves. You can go to Salem Chamber and check it out, or talk to Jameson Gideon, and he will help walk you through any questions that you may have. We also really enjoyed hearing about the Salem Free Clinics. If you've never been to one of their luncheons or one of their meals, I encourage you to do so. It will be impossible to get out of there without writing a check or doing something. And very powerful work that's being done right here in our community for the people that are not insured. I'd also sadly like to recognize the passing of Sharon Seidemann earlier in October. Sharon is survived by her husband, Richard, who was a Salem past president. Sharon was also on the staff team during CEO Mike McLaren's years, as well as new Tom Hofford as well. So I'll be thinking about her and her family. And then also another tough one, Governor Kitzhaber, Dick Withnell, and Tom Hofford are also going to go visit Senator Gene Derfler at this time. So be praying for him and his family as he's in probably what is likely his final days. So be praying for them. On a positive note, we have a winner for our Ross Fresh Markets bouquet right here, and the winner is Kay Evans. So congratulations, Kay. And with that, this is adjourned, and we will look forward to seeing you all on November 10th. Have a great afternoon.